In this video, you can see the placenta posteriorly. You can see a part of, this is the transverse section of the abdomen, and you can see the head, of course. This is the eye lens of the fetus, and of course this is one eye lens in which you can see the right eye, but the left eye is not appearing in this scene, and the nasal bone. But of course, what's very important is the uterine contraction here, and you should know what is the difference in the echogenicity between the uterine contraction and the retroplacental separation with hematoma formation. Because if there was a placental separation and then it ended by organization or organized hematoma, it gives you a picture or echogenicity which is completely different from the uterine contraction. Another point is that the uterine contraction unfortunately is mistaken as placenta previa in some cases. If you are not sure, or if you are still a beginner and you don't know how the organized hematoma is appearing or how the placenta is appearing, and so you can actually give a wrong perception of this. If you can see that uterine contraction in the lower segment, you may think that that was a placenta previa. And so that's very important to be sure that what is the difference between the echogenicity of the placenta and the echogenicity of the uterus or of the uterine contraction, and of course of the organized hematoma. The placenta here, of course, is not reaching internal os. And another finding here, which is very important as well, is how the cord is appearing, the umbilical cord, because I know that for the beginners, the coils of umbilical cord by 2D ultrasound sometimes are not very clear for many of the beginners. And so you should understand that when we see an ultrasound like this, you should know what we can see in this ultrasound. And so I'll try to pause this scene and to show you that if you are still a very beginner in ultrasound, what we can see in this picture. Please remember that if I'm using this, or I'm looking to this picture, or looking to this screen, actually there is a landmark here, and that landmark is very important because it should be at the same direction of the probe you're using in the longitudinal section. So if you are using the probe longitudinally, okay, suprapubic, and you can see the fetal head suprapubic on the mother, of course. And so that means that you should imagine that the lady's head is towards this side and her legs towards this side. Should imagine the picture. That picture means that when we have this landmark here and I'm using the probe, and there is a correspondence between this landmark and the landmark I have in my probe, so that picture automatically, you understand that the lady's head is towards that side, the left side, and her legs towards the right side. In this picture, what you can see, head apart, of course, that's just a scene. I'm not talking about how to measure or how to see the fetal biometry of the head. No, just what we can see or what is seen in this picture. And as you can see, I paused the scene. This is the eye lens of the right eye. The left eye is not appearing here. And this is the nose. This is the placenta. This is the placental border. Okay, so this is the placenta, and that rising of the placenta is a uterine contraction. And it's a posterior uterine wall contraction, and the placenta is posterior, and the placenta ended very high here. And so it's away from internal os. But of course, if you want to be sure, you should see the internal os, and to be sure that the placenta is not reaching the internal os, either anterior or posterior. What can be seen here? A part of the fetal abdomen. This is a part of a transverse section of the fetal abdomen. And here are parts of fetal limbs. So if you want to understand this picture, you should be sure what you can see at any time. Okay? At any time when I'm posing the picture, I can ask you about any of the contents of this picture. You should know what are these contents. Okay? Okay, let's regain again the scene. This is the scene again. Of course, after moving the scene, you can see the cord here, and you can see again parts of the fetal body. And of course, here I'm not actually focusing, or the area of interest for me is not the head to have a fetal biometry or to have any, for example, I don't want the biparietal diameter or the occipital-frontal diameter or whatever. I'm just focusing actually in this scene on the placenta and on the contraction. And that's very important for you, to be sure what you want to see or what you want to show especially if you're a radiologist and you want to have a picture, and that picture would be actually, as you can see here, this is a part of a fetal limb, and if this is a bone, of course you have to rotate your probe until you're reaching the longitudinal picture or the longitudinal section of the femur to be seen clearly, and so you can measure it later. Please try to get good pictures, and so especially of the area of interest, because these pictures are very important in your report and actually are expressing the comment you will write in your report.